acute effect of vibration on plyometric push-up performance. Whole body vibration is a technology that was developed by scientists in the latter part of the 20th century. It was originally adopted to enhance the strength velocity performance of elite athletes. However, in recent years, the use of vibration stimulation has gained a lot of popularity by trained and untrained athletes. Results have also found that vibration training is a relatively safe exercise system with the potential to be an effective alternative training method. How it works. The participant or patient stands on the oscillating platform. The platform then generates a mechanical stimulus that spreads throughout the body, stimulating sensory receptors such as the muscle spindle. This leads to the activation of the alpha motor neurons and initiates muscle contractions known as the tonic vibration reflex. The tonic vibration reflex is a continued contraction of a muscle exposed to vibration and caused by a vibratory activation of muscle spindles. Whole body vibration has become increasingly popular due to the proposed positive effects it can have on physical performance. It has been shown to improve muscle strength and power, and has also been associated with an increase in energy metabolism by increasing oxygen consumption, heart rate, and blood lactate concentration, which can potentially lead to an increase in bone and lean mass while decreasing fat mass. Alternatively, there have also been reports claiming that there have been no beneficial outcomes from whole body vibration. To date, most of the research on whole body vibration focused on lower muscular performance, with less research focusing on the upper muscular performance. In response, this study aims to explore vibration stimulus applied to the upper body, in particular the acute effect on plyometric push-up performance compared to pre-vibration plyometric push-up performance. However, as there has been no conclusive results in previous studies confirming the positive effect of vibration training on physical performance, the hypothesis for this study will be no significant increase in post-vibration plyometric push-up performance. This study used a repeated measures design where 10 university students volunteered to participate. Before beginning the study, participants had to read and sign an informed consent form and a pre-activity readiness questionnaire. Each participant completed a 5-minute warm-up on the treadmill at 5 km an hour. This was followed by 8 repetitions of a bench press on the ballistic Smith machine. The weight of the bench press was 20 to 30% of the participant's mass. After completion of the 8 reps, participants performed 4 reps of a bench throw at 20 to 30% of their mass. Once the warm-up was complete, the participant would then perform 3 plyometric push-ups on the in-ground force plate, having a minute rest in between each push-up. The technique for each plyometric push-up was important, so it was essential that the participant had their shoulders over the force plate when completing the push-up, and to have a 2-second eccentric hold followed by the push. The LabVIEW software collected all the data such as airtime, peak force production, and also concentric and eccentric rate of force development. Following the push-ups, the participant then moved onto the vibration platform. The participant was in a push-up position with their elbows slightly bent and remained in that position for 30 seconds while the vibration platform oscillates at 30 Hz. Following the 30 seconds, the participant then had 30 seconds rest before continuing back in the push-up position on the vibration platform for another 30 seconds. This procedure was repeated 5 times. After completing the procedure, the participant then returned to the in-ground force plate and attempted another 3 plyometric push-ups with a minute rest in between. The LabVIEW software collected airtime, peak force production, and also concentric and eccentric rate of force development that would then be analysed. The statistical program that used to analyse the data was Microsoft Excel 2010. Mean and standard deviation data was determined for all participant characteristics. Pre- and post-vibration push-up average airtime, peak force production, and the concentric and eccentric rate of force development was compared using a paired t-test to determine any acute effects of vibration on the participants' results. The data was tested at a significance level of 0.05. After statistical analysis of post-vibration average airtime, peak power, concentric and eccentric rate of force development, it was then compared against pre-vibration results. The results resulted in no significant difference in any area. Although there was an increase in both post-vibration average airtime and peak power when compared to pre-vibration results, it resulted in no significant increase. Both post-vibration average concentric and eccentric rates of force development showed a decrease when compared to pre-vibration results. However, these decreases showed no significant difference. These results differ from a study by Mepakatic, Belilinis, and Bishop. They reported a significant increase in peak power following 5 times 60 seconds on the vibration platform at 26 Hz compared to no vibration. It has also been reported that physiological benefits have resulted from long-term vibration training. An example of this is a study by Ida, Mishenko, Tomiak, Sorzan, Cooney, and Sasada. This study was an 8-week program that combined submaximal resistance and whole-body vibration training to a group of young females. The results showed that whole-body vibration appeared more effective for increase in arm, shoulder, and length, strength, and power when compared to the same group who did resistance training but without whole-body vibration. A decrease in post-vibration average concentric and eccentric rates of force development was unexpected and is considered unusual that vibration training would cause performance decrease. However, it is not the first time that this has been reported, with Poston, Holcomb, Guadagnoli, and Lin stating this has been the case in other studies. Similar results have been reported in another study where 31 male subjects participated in a whole-body vibration study of squat jumps, and at 40 Hz, the findings identified a significant decrease in their squat jumps. It has been reported that such significant frequency could potentially cause a fatiguing effect, and this could have resulted in the concentric and eccentric rates of force development deteriorating post-vibration. Previous research has not provided a definitive answer on the benefits of whole-body vibration training and its value as an alternative training method. A lot of factors come into practice, such as the frequency of hertz, amplitudes, the duration of the exposure, the work-to-rest ratio, and rest intervals. All of these factors could result in optimal performance. In conclusion, various studies have examined the acute effects of vibration on the body with varying results. The results from this study identified that vibration did not have any significant increase or decrease on physiological performance such as average airtime, average peak power, and also average concentric and eccentric rates of force development. However, there is no definitive answer to the acute effects of vibration training and the potential physiological benefits associated with it, so further in-depth studies may be required. Vibration training was not a useful implementation to see physiological benefits in average airtime and peak power. However, further studies on post-vibration training on plyometric push-ups could result in a significant increase for average airtime and peak power. Vibration training caused deterioration in concentric and eccentric rates of force development, so therefore it would not be recommended as a training tool to increase concentric and eccentric rates of force development. Questions? Here are the references that was used for this PowerPoint presentation. Thank you for listening to my PowerPoint presentation.